The Youth Forum is a collective voice of young people.
To use the young people as a vehicle to improve the NHS.
Trying to make a positive impact on healthcare policy.
Representing young people's views and making sure the NHS is accountable to young people.
Giving young people a voice.
Taking their views and then making a good informed judgment to benefit all young people.
Young people have a right and a responsibility to be heard.
Definitely can see the NHS Youth Forum sitting right up there with the decision-making boards and really making a true impact across the whole of the NHS.
I think the Youth Forum can contribute throughout the NHS's structure in a variety of different ways. It's just how we want to utilise that power.
I've used a lot of NHS services and I have quite an inside knowledge which can help to contribute to ways that can be changed and learn from it.
You know, by posting out little questions like, what do you think of this? You know, how could the NHS be improved? You might be able to engage some dialogue with some young people.
We will reduce the stigma around teenage mental health.
We will amend current guidelines given to doctors and look at training to improve the communication between young people and healthcare professionals.
We will be working with charities such as Brooks to destigmatise the use of sexual advice services.
Transition work for me is a huge thing because children don't go straight to adults. There's a gap in between for young people. You can't expect a child to go straight to adult services without being prepared for it because they'll be vulnerable at that time, so it's not fair on them, and it's just trying to improve that for me.
We are already networking throughout the NHS England so that they really are understanding what we're here to do.
I think Neil, who is the Director of Patient Experience, he was really up for it because he said one of the things they were looking at the moment was getting a lot more feedback from the people they work with, like patients and things. And so he said he was quite excited to be kind of working with young people and get their opinions and get a way of getting their feedback into the system so that we can change things, hopefully for the better.
As much as maybe adults might not want to hear what young people have to say, they really do as well because, in essence, what we say actually helps them make the services even better.
I hope we'll be able to kind of make our mark on the NHS and really shown the adults in the service that young people do have a voice in the NHS and in healthcare.
In a year's time, I would really like to see the forum making real change and making a difference, because there's no point having a forum with not making a change. So creating awareness, letting young people know that this forum exists which can take their voices forward to those people who are responsible.
Nothing's going to change overnight, but you can start to build an impact, and that's the only way things are going to happen.